No problem. Yeah, yes, you can. Ritik, can you listen properly? Okay. Hello, can you listen properly? So we are starting our session of epidemiology, statistics, and research methods. तो पीछे चले जाएंगे दिस शुड बी गोइंग बैक तो यहाँ आवाज आएगा तो नहीं आपको एक आदमी कौन रहेगा आप में से वो फीडबैक देंगे ना हाँ ठीक है तो बट दे शुड बी ऑन उसका वॉइस चालू जो वॉइस चालू है तो फिर बैठना पड़ेगा
वॉइस आ रहा है
we are starting our session on epidemiology, biostatistics, and research method. So first and foremost, we'll be starting why we are going to learn this. So now we are starting with why. In the era of the artificial intelligence, in the era of the machine learning or robotic surgery, etc., why we need to learn statistics, epidemiology, etc., because already the software there, which will be do work for you. Why human being is required for that? So the purpose of this session is basically to how to apply the science for betterment of human life. If you look at the purpose of life, there are different purposes for different people. Someone say, I need a good health. Only maybe 1% will be looking for that. Maybe around 80% will say, I need a wealth. Maybe around another 1% may say, I want to attain a spiritual goal, and miscellaneous. Now, in this case, usually people say that they learn it subject in terms of medical. But our purpose is not only that medical doctors should be learning this, but other people, maybe a commerce or maybe a arts, all these people require this epidemiology, biostatistics, and research method. Because nowadays, there are various kind of good research, the people are doing a furious research, and then rest of the people are borderline. So we say that, not hearing anything. Can you listen here? Just can you listen it properly? There is some people say not hearing properly here. You can listen. Okay, no problem. Now, still voice is there, no? Is basically very interesting. If you find out the root cause analysis, it will be helpful for you. Just if you do one exercise, the game of why. Ask Why for 5 times? And you will find out the root of the cause. Let's take an example. You ask the question why there should be malaria. Very interesting subject. Any intern doctor students presentation is not seen.
Now no slide is visible, only voice is coming, and voice is also not coming at present.
एक मिनट में चालू हो रहा है. So basically, we were talking about a root cause analysis. If you do it, just ask 5 times, and I'm sure you take any disease, and at the end, root will be very simple: ignorance, yeah, the political will, or there is a lack of control in the mind. All such things will come. Taking an example of a malaria, and then this thing can be done very easily. So let's say that 5 times we want to ask about malaria, and then we'll be coming to back to the epidemiology biostatistics research. So, for example, the question is why there is malaria. So there can be a multiple reason. One reason could be mosquito bite, and not a simple mosquito. It has to be infected mosquito bite. Infected mosquito bite. And then other thing is reduction in immunity. If you are very good immunity, then malaria will not bite you. Why malaria? That is the first time. Now, if you are second time, why infected mosquito should bite and why there should be less in immunity? So this is the second why. Now, when you ask why infected mosquito should bite, there will be reasons, and why immunity should be less, there will also be reasons. In this case, here could be infected mosquito bite because malaria patients are not treated properly, not treated. That's why mosquito will bite and then will get infection. Other thing is mosquito breeding is more. Mosquito breeding. There will be so many other reasons. People are not using mosquito net, etc. And why immunity is less? Maybe a dietary problem, dietary deficiency, or there can be stress because of why the immunity goes down. Now, in this case, if you ask third time why malaria not treated properly, mosquito are breeding is more, people have low dietary thing, people have more stress, then here also there will be a reasons. Over here also there, and then suppose in dietary it says the more people are using that ready to eat packets which are full of chemicals and all other essence, or using the refined wheat flour, there's carcinogen, so many things that people are taking in dietary. In stress, maybe unemployment or stress at the level of the office level, etc. Then that will be a four time you ask why. That is a four time. And then if you go further, then you will be able to find out what is the you take another is in a group at the when you ask to fight and why, at the time human greed is so that is the first thing.
અવાજ તૂટક તૂટક આવે છે સાહેબ.
So treatment burden will be increased. Second thing will be when you think of also wages, then this can also be there. But now we ask second time, so what? So what? It's very interesting that at the end, when you get, for example, loss of wages will lead to poor diet and so many other things. School dropout will lead to low education, decreased awareness. Lack of treatment, increased burden of the treatment. So what? Third time, fourth, and fifth time, if you go like this, then you will find that there is some relation with this factor reasons also, and there is cycle going on. So, as an epidemiologist or postgraduate student of the community medicine, should prepare such chart, and with a common 10 or 20, 30 disease, if you take it, then you will be able to find out where you can work. You need to divide whether you can work at this level or that level. And based on that, you need to create a matrix. And when you create a matrix, then probably you will be able to find out where we should be able to work by giving a minimum input, how to get a maximum input that this diagram will tell you. So this is exercise is to be done by each participant as a part of the course. And then next thing, when we talk about epidemiology, epidemiology will help you what are the factors affecting. But if you want to quantify that, how we can find out which factor is more important, in that case, we need to do statistical analysis. And we'll see in EpiInfo software is prepared by the WHO, which gives you very ready-made solutions for the purpose of analysis. I will give an example. 75 people attended a party, food party, maybe a birthday party, a marriage party like this. They took something like 25 items. Few people sick and few people were healthy. They don't fall sick. So out of this 25, which item is causing more problem? If we want to find out that, then the best thing is to do the logistic regression analysis, which is so simple. Logistic regression, which is very simple. Only it takes less than 2 minutes to find out which one is affecting. It is so simple. Now in this case, this APInfo software is so easy that you need not have any programmer anywhere in the world. APInfo software itself is sufficient to give you all the kind of programs. It is a basically program generator. You can do your own data entry, etc. Now, research methods. Research is not at all difficult if you know epidemiology plus biostatistics. You will be able to do most of the research methods, except two methods like focus group discussion and qualitative research. You may not need a biostatistics, but still you need to have sound knowledge of epidemiology. Now, basically, why we are learning this, that it is to manage the complexities of public, private, and political system. Looks very difficult, but what is going on right now between the USA and the India and Russia and all those things is a global politics is going on. Now, can we find out solution with the statistics while this research method and all those approaches? Yes. If there is a group all over the world, let's say there are 1,000 people who are very neutral and they unite together and find out the reasons, they can definitely find out the reason where you need to stuck up. If you want to reduce the war among in the world, still epidemiology can find out the reason and we can control that. And not only that, but to develop, implement, analyze, and evaluate diverse health and health-related policies and programs. So many policies used by the government. Some of the policies are for the betterment of the political party, and some of the programs are for the betterment of the people. So, if you want to find out the difference between these two, that also epidemiology will help you. Now, stepwise systematic understanding of all these subjects together. What is epidemiology? Now, suppose there is a 10,000 population and you want to find out what is the burden of illness among the population. Then naturally, you should have the data. Number one, what are the problems? Diabetes, yes or no? Whether yes or no? Question you will have for 10,000 people. Based on that, you will find out who are affected, where they are affected, all those things. So distribution will be there. But then while you do the analysis, why people get affected, that is the core thing. And that analysis will tell you why people have diabetes, why some people are having malaria, why other people are not having malaria. And for that, when you want to apply test, when you become prepare a 2x2 table, again the APInfo will give you the solution how to do the analysis. Towards the end of this introduction, I am going to give a demonstration of APInfo so that you are confident, yes, you can also learn that. Other thing is, this course is basically not a passive thing. There should be real life the case studies. All of you will be advised to generate a data set, meaningful data set, do something, and not only find out the problem, but with help of epidemiology, research, etc., you should be able to do some difference in the life of the people. And so everyone should attend this, not with the only the mobile, but you should be using laptop or desktop so that we can do the analysis, and then only it will be very interesting. Other thing is interaction, clarifying the doubt is very, very important. Two-way questions answer that will be done at the end. And decision making flow chart. There are so many statistical tests. Which test is to be applied where? How do you know this? For that, we are very, very simple flow charts. For example, whether your data is something where you can find out the mean or you can find out percentage. Your how is your data that we need to find out. Now, based on this, you will be applying. So first you should be learning that which data gives you mean, height, weight, hemoglobin, blood cholesterol, that gives you mean. While person is suffering from diabetes or not, person is suffering from malaria or not, from COVID or not, person is white or black. All these characteristics, they are considering the percentage. Now, whether you are comparing with a sample with a population or you are comparing two population, or you comparing three population, based on that, so many the things become very simple. And in just 1 hour, you will be able to find out which statistical test is to be used when. And not only how to do the manually, that is now obsolete. We just understand the manual for the purpose of understanding. Otherwise, there is something like table command, there is something like means command, something like regression command. All these commands you will be able to learn in Epinfo so that you can do analysis very easily. And when you do the analysis with the Epinfo, it is not necessary that you collect the data in Epinfo. Whether you collected data by the Google form or in Excel, anything, in whichever the database, Epinfo is able to read most of the database. And you can do that analysis easily. This Epinfo software, the moment you start learning, which we'll see after a few minutes, and you will say that, no, it is very interesting and I would learn further. There will be 12 sessions. In these 12 sessions, most of the concept of epidemiology, statistics, and the research method will be there. Now, this ocean is too big, but if you learn how to sail the boat, you'll be able to go wherever you want to go. So what we are going to teach you is the basics. One, we teach you how to refer to the AP Info manual, how to take a help. Then you will be much ahead than me. I'm still a student of statistics epidemiology, and we'll learn together. I am learning from my students also. Now, before you join the course, you are supposed to have at least some database with you. If it is not generated by you, then you are working with some PSC or CSC or hospital or your own clinic. There has to be some database with you. Then, if you work on your own database, then understanding will be much more. In course duration, there are 12 sessions and 6 weeks. But after the course is over, for 1 year, we can remain in touch for the purpose of the much better understanding. It will be in English, online, any 2 days, not necessarily Monday or Wednesday. It will be any 2 days of the week, night 8 to 9. And for all the 3 medical colleges, 3 high-tech medical colleges at Rourkela, where I'm a professor and head of the community medicine. I'm also dean of academics and research. And other 2 colleges at Tirupati, there's a high-tech medical college. In Bhubaneswar, is a high-tech medical college. Three these medical college, all the students, PhD students and faculties can learn this program free of cost. Sensitivity, etc. People say the sensitivity, all those is very difficult. But I will tell you, say for example, sensitivity. If I say a little bit harsh word and person becomes very agonical and not liking and feel very bad with a little stimulus, that means patient is very sensitive. So if taste is very sensitive, even a little stimulus somewhere in the person will be able to find out. So that is a sensitivity. Similarly, we'll be talking about other things also. And this 6 parameter of testing is very, very easy and you will be able to remember lifelong. Other thing is outbreak investigation is so common, but finding out the first case and the linking is very important. Way back in our days, we found out of 2,000 cases in Anand, in epidemic of the hepatitis, we could look at the first case. And the reason was also the cross connection between the pipeline, the water pipeline and sewage line that was clear cut indicated. Similarly, a few years ago, there was a epidemic of hepatitis, but that was because of aflatoxin. There was no other thing than that. So meticulous data collection and the analysis, you will be able to find us. For example, in COVID-19, so many people died. That was mainly because of the lack of international coordination. Hardly people were sharing the right kind of data. So we are here want to develop a worldwide database whereby those who want to remain healthy can get connected, and that's why we have formed the Human Health Circle, working for so many years. I stands for homeopathy, U stands for Unani, Universally, and all other systems, which includes the Reiki, Sojok, etc. M stands for modern medicine, in which I have done my MD in community medicine. And I'm fortunate to have under the learning under Dr. N.R. Mehta, who was at Surat Medical College. Together, if we combine everything together in a scientific way, then we are going to have a best result. And that's why we want to have a coalition of the databases. Normally, probably all over India, people knows that COVID-19 was cured much faster and much better at home with a very simple home remedies. Even mucormycosis was also very simple to cure with Ayurveda. But the life-saving support was much better with the allopathy. So if you would have combined the things, then we could have reduced the mortality, we could have reduced the morbidity together. So let us think that we have a database whereby from all over the world who are voluntarily want to find out why there is a reason why people fall sick, why some people don't fall sick, then let's say that we have this kind of database available and it will be anonymous, right? So only people can know their data. Now, when it is to be analyzed, except the name and phone number, location, location will be the city base or the village base. It does not pinpoint the some address, etc. So here it will be a various symptoms, 1, 2, 3, 4, 5. Then there is a science, then the investigation. For example, investigation, the laboratory which are under doing a health checkup for that purpose, that population is almost normal. What is happening in Odisha out of 10,000 people who were checked for B12 and 10,000 people who were checked for B12 in Gujarat and is out of routine data checkup, not a sick people, then you will find out where is the B12 deficiency and why. Similarly, there is a treatment and outcome of treatment. In diabetes, which kind of treatment people are taking in USA, in Canada, in Gujarat, in Odisha, across the world, if you compare various systems of the healthcare system, then which combination is working well, which combination is killing the people, all these things you will be able to understand. So simply, if you want to do it, then there has to be common database across the world. Or there can be a database separate, but then heading should be the same. The code number should be the same, just like ICD-11 is a common code. So if we have the same code language for other things also, we'll be able to uh, compare the data.
हाँ अब आती है मैं
Other
कहा
thing would be the natural source of data collections, etc. That will be there. Now, these are most important. Your own data set, you are supposed to do the analysis, because when you want to do a multivariate analysis, at that time you will able to find out, pinpoint which one is more important, which one is less important. Suppose if I ask you a question, you need to spend rupees 1 CR for one block having 1 lakh population. How we are going to use in the best possible manner? Right now, the policy decision and the program decision are most of the time centrally decided. But if we are deciding a locally a bit, then it will be much powerful. In this case, just giving example, there could be 2, 3 approaches. In that, if people learn, I would say that at a village level also people should learn epi info. I repeat, at a village level or at a community level in a society of 10,000 population or 1,000 population, there should be 2 male and 2 female who should understand the status in their own society why they are sick. When they will learn, that will be much better application of the science. Now, this is critical review of scientific literature. Of course, that will be there in the groups. Certification at the end. Sometimes in our past, there is experience of various students. They don't attend the classes. Even they don't go through the video which we are sharing with you. And at the end, they expect a certification. It is not like that. This is a 26 our national level workshop. Initially, it was offline. Now it's online. That we don't give certificate without confirming that you know the things. So if you have a time to allocate, you can get after 3 months also, no problem. For 1.5 months, 6 weeks, you should be able to spend 2 days, 2 hours, that is in a week. And if you fail, then you can extend another 1 month, 2 months, no problem. But you should complete your project, etc. Now, what we are doing, suppose there are 30, 40, 50 participants, then we divide into 5 groups, group of 5, and the number of groups will be as per the availability of number of the students. One student may be from the Uttar Pradesh, other from the Kashmir, other from Gujarat. So they would try to work together. So the first thing is making the groups. Second is distribution of country, state, district, etc. Some people will take a France, other people take USA. Their healthcare system, you find out which one is best. Together, we go for the best. And the word ecological correlation, people don't use most of the time. Ecological correlation. In which you have a large geographical area at the different places, and you don't compare individuals, but you compare the whole mass of the people. 1,000 people here, 50 had a malaria. Here the humidity was this much, temperature was this much, rainfall was this much, like this. You compare across the large geographical areas or large communities and then find out why this is happening. Instead of individual data, you have the group data available for that. So that will the second group will be doing that. Third group, that will be a topics for compilation from the course material. For example, someone will be looking at A.P. Hill's short textbook of statistics other person is going to work on, let's say, epidemiology, third person going on the focus group discussion. So the participants are given certain exercises and they will share together, and that will strengthen their learning. Is the 12 weeks or the 6 weeks, 12 session will be, you will be remembering lifelong. That is a very, very powerful learning. Then you maybe compile a book and prepare a book from your learnings. There are ideas for further simplification that also you can do it. Then advanced statistics. So many things I know statistics less than 10 or 20%. But then once you have a powerful basis, then you will be go for the advanced statistical test also. Other thing is very, very important that you should be having zero registration. Then you should having Darpan ID. And we are going to we have already collected 5 lakh companies who are giving CSR fund. So we should be able to approach the right company. I have a state-wise data. I will be sharing with you so that you can tap that CSR fund. If you do not have your own organization, we can put you with a right organization so that you can work in a collaboration. You do the research under a particular NGO who has a power. They have a their party, they have a zero registration. You work in that collaboration and then look for the funds so that you can do much better. And then innovations. In innovation, we have a list of 50 innovations. For example, we can do the bright vision detector, can find out that what is the capacity of the eye to identify the object in dim light, in minimum light. The light is measured in terms of millilux. It's the first time in the world and it's already sent for the patent. Similarly, ideas we'll be sharing with you, innovation we'll be sharing with you, and then you can apply for the funds, the startup under that various scheme, and then you can move further. Other thing will be evaluating. And now, last but not the least, purpose of life. In that case, whatever you are doing, 99% of the activities you are doing ultimately for the purpose of joy, happiness. But now, if you learn a technique whereby without spending a single rupee, if you can get this joy and happiness 24 hours a day, all the 7 days a week, and all 365 days a year, throughout your life, if you can go for joy and happiness throughout your life, probably there's the end. But to achieve that, again, you need to apply statistical methods. Who are people who could have achieved this and how they achieved that we can learn. Other thing is collaboration of students of various branches of the ideas of One Health. One Health, together we are working for the universe, and not only the medical students with one college to other college, but medical students with the engineering students, with the home science students, together we work for the people. So before I end over here, I would like to give 1 or 2 examples, and then the forum will be open for the question answer. There was one doctor, very intelligent fellow, and he came there and told me that doctor, I have found out a solution. And what he did, he measured a glycosylated HB, what we say HB1AC, and based on urine creatinine. Now think over, a doctor which had drawn a diagram whereby he was able to find out glycosylated hemoglobin based on urinary creatinine level. Such a wonderful nomogram. But what we did, we applied AP Info software. We did the data analysis in AP Info. And when we standardize the data and remove the effect of confounding variable, we'll learn what is a confounding variable, how to standardize the data, etc. But when we did that, there was no absolute correlation between. Then why was that fellow was getting this spurious association? That was because he has not considered, he has not standardized age. As age was increasing, glycosylated hemoglobin was increasing. As age was increasing, urinary creatinine level was increasing. But when we remove that age factor, there was no correlation between urinary creatinine level and the glycosylated hemoglobin. So such spurious data analysis can be avoided. Other thing, very simple. In a medical college, few students are passing with good marks. Other students are failing. Why it is like that? Oh, two people, 10% of the population are having depression. 90% not having. Why? So all these things we can learn, we can do the research, and that's why this is a session or the course which we have developed. And if anyone wants to ask any question, now forum is open and you can do it. I will stop sharing the thing. And after 5 minutes of question answer, I will just spend 1 or 2 minutes or maybe 5 minutes for AP info, what you are going to learn in that. I will close this. I will share the screen.
Sir, if night duty, then how to, we can see that lecture later on.
Now you can ask the question, then we'll be looking at this AP info software, right? Any question?
Sir, if night duty, can we see
Then
lecture?
I can think of starting sharing my screen for AP info software, which is prepared by WHO. Equivalent software SPSS is costing something like 2 lakhs, 1 lakh, like that. Any question? I think people can open up their mic and ask the question. But I'm eager to show you the AP info, but I would not till someone asks the question. You can try to unmute.
Sir, if
For
somebody
example,
left a lecture due to duty, night duty, or some illness, can he or she see that lecture, recorded lecture later on?
yes, not only that, we will give you all the previous lecture. Maybe around 12 sessions, full lectures will be given access immediately. In fact, we believe that we are not going to last in the world so many years. So we would like to see to it that the moment you join the course, try to teach other 10 or 20 people immediately with whatever material we have. We are going to share you with the material, PPT, etc. So the purpose is not only for one or two people, but large masses we should be reaching. So you can definitely start teaching others. Any other question? It's good that someone asked the question. Let me finish the AP info first within 5 minutes so that you can understand how easy this software is. Absolutely easy. And we'll also share this software with you so that you can download, you can use easily. And not only you can use it easily, but you can teach others also easily. There are 6 menus in the AP info. You generate the forms. That is for the purpose of data collection. No program is required. Enter the data and do the analysis. And for statistical, for the purpose of sample size, is very difficult sometimes, but this can calculate very easily. All this is so easy that even the 10th pass person, if knows a little bit of English, then also learn. We have also conducted this course in Gujarati for even the health workers. It's so simple. So this is the first step is to do the analysis and read the file. And WHO has given a sample file whereby people can learn themselves. And there's a manual available to use this. And out of that, we have one Oswego file, which is for the purpose of data analysis. 75 people, 75 people attended a course and they attended the party. And in that party, out of 75, few people were sick, few people were not sick. And you can see the tables command in which we are comparing the exposure variable. For example, fruit salad versus illness. So in seconds, it gives you what was the relation or not. And p-value is automatically and shows that the salad and illness, no problem. That we are going to learn. And if you want to apply the logistic regression, why there was an illness? Right? Why there was the illness? So let's say illness was because of which factor? So there is a people took a Zello, someone took the coffee, other people took a milk, and there was male female difference also. We take all 10, 20, 30 together. Right now I'm taking few together, 6 or 7 things which are most likely cause. A vanilla probably you might be liking, yes? So vanilla and other things like, let's say, the chocolates. So all this, you just give a phrase, okay, and you will get the result. Amazing. That if a jello is taken, the p-value is 0.6, that is no statistical correlation. But male, female, you can see the p-value is less than 0.05. There was a relationship and female were more prone compared to the male. It is shown from the odds ratio. You can find out that And from coefficient also, you can calculate what is the regression. And if you look at the vanilla, the p-value is less than 0.0000 is a highly statistically significant that vanilla is causing the outbreak. And if you look at the odds, which is 32, almost, we can't say 32 times more, but it suggests there's a strong correlation between the vanilla and the. So with a single, within 5 minutes, you will be able to find which are the factors respond or not. Not only that, it gives a lot of things. And Epinfo, very easy software. You will be able to learn in one session and then you can do the practice. I stop sharing the screen now and for the session is open for the question answer. And not only this, whosoever joins, we give them the digital health kit, which we are going to launch for Diwali and New Year. That digital health kit gives a lot of software, the nutrition software. You don't require dietitian to calculate all those things. We have the personality assessment of the adolescent to find out if they are depressed or not, college student, etc. We have the telemedicine software, we have hospital software, we have the software which combines all the parties together, and the rights is given to the patient to enter their own data. And you will go to the doctor that if you want to enter this data, I will come to you, I will go to the other doctor. Or nature cure, homeopathy, everything can be compiled and kept in that software. Then we have the software for the medical students or any other students, so that parents can find out whether the student are attending or not. And the bright vision detector, we have that machine, and that machine can also be set on a rental basis. Of course, the machine is costing 3 lakh. We can give at a token amount for those who want to involve themselves in the research. So, and any other question, now we are open for that. Any question? Ritu, you want to say something?
Keep a link for 1500 payment.
So if someone wants to subsidize the course, apart from that, the high-tech medical college, you can do it. And we are going to start virtual medical college, not the word college, but virtual medical education, where there is already 800 faculties across the nation have joined. And then we are going to, and under that, we are going to start online education, anatomy, physiology, everything, later on super specialty also. So we'll be sharing all this information in the group which you have already joined. Right? So, any other question? केडी ने तो प्रश्न होए केडी ने प्रश्न એવું ના હોય केडी you can ask a question. It's good that you joined.
તમારી જોડે ભણ્યા છે એટલે પ્રશ્ન તો તમને પૂછીએ જ ને, જવાબ સરસ સરસ મળે પછી. Thank you, sir.
So KD is a person, Dr. Kunal. He has written so many letters to Prime Minister Narendra Modi. If anyone wants to learn how to write to Prime Minister and make a change in the society, then I will share his contact number if he agrees in a group, which WhatsApp group which we have prepared, so that we can make a difference together in the society. Thank you, KD. Is my student.
Thank you, sir.
So let us close the session, and you can ask the question in the group also, and let's have a better society. I'm looking forward for maybe 20, 30 research papers, not only research papers, but research projects which are funded well, and then together we can do it. Thank you all.